Hello and welcome to another micro-learning session. Today we're going to be learning about ventricular fibrillation. So, learning objectives: define what VFib is, recognize its clinical characteristics, recognize the signs of cardiac arrest, and describe some of the emergency management. What are we going to do when we find this rhythm? So what is VFib? VFib is a chaotic heart rhythm. It looks like just a squiggly line, if you could. No cardiac output, so these patients will never have a pulse that are in VFib. The ECG shows a rapid, erratic, and disorganized rhythm. And this is a medical emergency. These patients are in full cardiac arrest. They have no pulse, and they're relying on us to resuscitate them. So here's a little guy showing you kind of the actions, right? The patient has crushing chest pain. They fall over, and they start having that intense discomfort, and that's when they're going to fall to the ground, and we're going to initiate that initial BLS response. So normal heart rhythm, you see it here, originates at the SA node, goes down to the AV node, and then perfuses to our impulse to our lower ventricles. With VFib, we have this chaotic ventricular response that results in that very squiggly line you see right there in the background. So that is our traditional rhythm that we see with VFib. There's other types such as fine VFib that may just be a little bit skinnier on the line and kind of mimic asystole, but VFib is the main one we're going to talk about. So what do we do for management of VFib? So we're going to recognize the cardiac arrest. This is the same. These initial things are the same for asystole, PEA, VTAC. We're going to look for signs of arrest. We're going to assess quickly. That's when we're going to our patient. Can you hear me? Can you hear me? Check a pulse. No pulse, not breathing. Initiate CPR. We're going to activate the emergency response. Call 911 if needed. If not, use the wall button. And then we're going to get our AED, right? The only thing, and I want to stress this so much to you guys, the only thing, you could be the best compressor out there. The only thing that's going to get them out is AED. So if they're in a lethal rhythm, they need shocked. Your compressions could be great, but we need the AED. So medications for VFib, this is very similar to VTAC, right? Very similar to VTAC. We're going to give epi, first-line drug for almost all of these. We're going to give amiodarone, which is an antidysrhythmic, and the alternative to that could be lidocaine. But regardless, all the meds that are going to follow this, these are the two main ones. Epi and amiodarone are the two main meds we're going to give for VFib. So some NCLEX questions as we're looking at it. The client suddenly collapses unresponsive. The monitor shows VFib, which means they do not have a pulse. The priority action for VFib, marry these in your mind, VFib, DFib. What is the nurse's priority action? Will they get epi? Yes. Will they get compressions? Yes. Will they get a synchronized? No. Will they get intubated? Probably. What is your priority? So after, if DFib is not an option, right, because DFib is the only thing that's going to get them out, we're going to begin chest compressions while we go get that AED, right? So we start chest compressions, get the AED, put the pads on, immediately shock. During a cardiac arrest, the client is pulseless and is in ventricular fibrillation. We know that because they're in VFib, they shouldn't have a pulse. CPR is in progress with the AED attached. Beautiful. So we have an AED on them. What action should the nurse anticipate after the rhythm analysis? So if the patient is in active VFib and either the AED or us stop compressions and do the rhythm analysis, right? So if it's an AED, it says stop compressions analyzing, and a cardiac arrest in the hospital will be hands off, let's look at the monitor. The first thing we're going to do, administer amiodarone. That's a good option, but it's not the first. Administer atropine? No. Deliver an immediate unsynchronized shock. Well, that sounds pretty good. Stop CPR until the rhythm becomes regular. The rhythm may never come regular with just CPR. So what we're going to do is we're going to deliver an unsynchronized defibrillation, right? That's our priority action with VFib. So some key takeaways: VFib is a medical emergency. It causes sudden cardiac arrest. It still is better than asystole, because asystole, if you watch the asystole video, all we have is epi. At least with this one, we have amio and we have electricity. So those are two good options that we have. Immediate CPR and defibrillation with an AED. Post-resuscitation, we'll do EKGs, intubate them, they may get an ICD, and we play an important role. Nurses many times are the ones that are going to be recognizing these rhythms, doing the initial management. So you play an important role, and that's why I'm hoping that you got into this profession to change lives, to bring people from a medical emergency that is requiring very invasive management and get them back into a regular perfusing heart rhythm. Thank you so much for joining us today on the microlearning, specifically for VFib.